Some people might listen to this and think, is this just another platform to blame doctors? Is that it? Tell us what it's about if that's not it.
We're just here to talk about the issues, to highlight the issues. We want patients to find their voice whenever they have interaction with doctors. We want doctors to be able to explain better, and we are equipping them with those skills. And we also want stakeholders to realize the importance of communication in healthcare, that it's not only a soft skill, it's a safety skill.
Relationship skills, relational skills are not really taught in medical school. And then when you talk about who is a good doctor, you talk about people that have skills. Oh, you can do this, you can do that. But if you have the skills, that's very important to have skills. But if you can't communicate along with the patient, I think it's still deficient. And a lot of patients are beginning to see that.
Hi there. If you've ever felt confused, afraid, or uncertain after you left the hospital, or as a healthcare worker, you felt emotionally drained after a difficult encounter, this podcast is for you. Welcome to Care Conversation Podcast. This is a place where we have honest conversations about healthcare, especially those ones that you don't hear often. My name is Dr. Sani Emmanuel, and with me we have Dr. Temitope Oyetunji, the CEO and founder of Patient Doctor Forum Nigeria, and Dr. Zuliat Sani, the Director of Research and Communications at Patient Doctor Forum Nigeria. It's such an honor to have you there.
Thank you.
How are you guys doing?
Thank you.
We're doing fine.
We're fine. How are you?
I can't lie, I'm so excited because this is something I've been so passionate about for years, and having an opportunity to have such important people here in my midst, it's an honor. But let me not get ahead of myself. Before we jump into the bigger things, Dr. Temitope, can you tell us what is Patient Doctor Forum and why it needs to exist? Why now? Why this podcast?
All right, so July last year, I became a patient relative when my dad became ill. And the hospital where he was admitted, where what I experienced there shocked me. And it made me realize that what I understood about communication with patients, what I practiced, was not common practice everywhere, right? And that experience stayed with me, and it made me to write my first book on patient empowerment. That's The Smart Patient. And after writing that book, it's like this phenomenon when something that just occurred to you, you start seeing it everywhere. Something that caught your attention, you start seeing it everywhere. So I started seeing the gaps, the communication gaps in my practice. I started seeing it everywhere. And I was wondering, why isn't anybody talking about this? Why have we just normalized the fact that doctors don't communicate well, or patients don't understand most of the things that they hear in the consulting room? So I made a decision. Let's talk about it. And that was how Patient Doctor Forum Nigeria was born. And then this podcast is like a grandchild of that idea. So that's why we're here. To answer your question, why the podcast or why Patient Doctor Forum Nigeria, is because I had a negative experience of healthcare, and it was reinforced by the things I saw every day in my practice. And I felt we should have these conversations, because if we don't highlight the problems, we can never get around to fixing them. So the first thing is for us to highlight the problems, describe them, then we can go ahead and fix them. So it's a major gap in healthcare that I saw, and I felt, okay, let's do something about this. And that's why we're here, because better conversations really indeed lead to better care.
Wow. I don't. Woof, it's gonna be hard today. Scary hard today. But I almost forgot I was a host and became a viewer when I heard you speak. And guys, don't forget, she just mentioned that she's an author too. I didn't mention that, but that shows you great things are coming. I truly do believe that these things, these conversations directly impact our healthcare and the outcomes. So I look forward to how we can do this. Dr. Zulia, what is one communication issue you say in healthcare that that needs to be highlighted?
You have to look at it from both sides, from the patient's aspect and the doctor's aspect. You understand? A lot of times, the patients, they have their own personality problems. They already anxious about their
Yeah.
illness while they are here. Maybe they didn't sleep throughout the night, then on getting to the hospital, perhaps they had some other, because communication gap cuts across all
Yeah.
cadres, not just doctors. So perhaps at the gate, someone annoyed them, at the front desk, someone. So and they're getting to you last. So they're already anxious. They're frustrated, coupled with the fact that they don't even know what to ask. They don't know if they're allowed to ask this. Some of them are timid. So it's a whole lot of things into one. Then you now look at the doctor that is perhaps burnt out, is busy, has seen several patients that it's, way beyond the allotted time supposed to see. And then so it's the communication problems that, they are multi-pronged. Yeah.
Wow. When you mention these things, I can see that it's apparent, it's in front of our eyes. But why do you think it's not people don't talk about it? It's like silence in our.
Well, I think it's kind of been normalized, so everybody feels, well, that's just the way it is. That's just the way it is. I saw there was one post I saw on one of the social media platforms that they said, okay, who are one of the rudest, what they call it, professionals, and then
They
people
mentioned
were voting.
doctors.
No, no, it wasn't. I was surprised. They said bankers, nurses, and then they said midwives, and then they said doctors. You understand? So I was reading. I was like, no, this is not a good look on us. So that's kind of view people have about healthcare practitioners. So
And that's ironic considering the hospital is where hospitality is supposed to be.
Yeah.
Oh,
it's
wow. Dr. Temisobe, what do you think is one thing that stands out when you hear this? Like this entire communication issues and
Yeah, so I think, like she said, it's on both sides. Okay, so both the patient and the doctor, they leave things unsaid. They hesitate throughout the consultation, they leave things unsaid. And for the doctors, usually, you would know when a patient is not really getting what you're trying to pass across. Most of the time, we know. But sometimes we still move on because, number one, you may be under pressure. Maybe you have other patients you need to see. So you move on because of that. At other times, you may be tired, you may be exhausted, you may not want to go into explanation that the patient will be able to understand. But another key reason why we move on is that we really don't have the skill to break down that communication in a way that the patients can understand. Let me give you an example. Just a few days ago, a patient in our care wanted to sign against medical advice. And when the medical officer that I was working with told me about it, I knew I had to speak with them. So I went and I spoke with them, and I found out that they didn't really know the consequences of that action that they were about to take. So I had to take a different approach. I used a specific communication framework to try and get to them. You understand? And it worked. It made a difference. They told me that after the discussion that they were going to think about it for a few minutes and then they would let me know what their final decision is. And guess what? They still went on to sign the down. They still went on to sign against medical advice, but it made a difference. That decision that they made was well informed. They knew what they were doing. So we will not win all the time with patients. We are going to lose some, but let it not be because we don't have the right skills to communicate effectively so that they get exactly what we are trying to pass across. So that communication skill is a big gap for doctors, right? Not everyone has that skill. And it doesn't always come with practice. It's not as if you catch it. It's it's being intentional. You have to be intentional about learning it. And those are some of the things we're trying to bring to the fore, that these things we need to be intentional about teaching doctors communication skills. Don't hope that they will just pick it up along their practice. We should actually teach these things so that we get better care.
you know, you caught me on that one. But I just when you're talking, I just remembered too that on the flip side, we now see how so many of these informed conversations now help a patient truly see that it's in their best interest sometimes. Sometimes it's so easy for a patient to see, the doctor just wants to do this, doctor just wants to do this. But these conversations really help us to see and know how important it is. But let's talk perception. You know, in situations where the doctor you feel you've done everything you could, but why do patients still walk away feeling unheard, feeling that, like, he's not hearing me, and the doctor feel like I've done everything. You feel like you've counseled. What do you think about this?
Yeah, so again, there are many reasons. Now, the first is, even as a doctor, I've been a patient a couple of times, and even as a doctor, when I'm on the other side of the consulting desk, that power imbalance, I still feel it. So there's this perception that doctors know better. And when patients feel that way, sometimes it suppresses their voice. They feel they don't want to voice out their fears, their doubts about maybe the treatment procedure because they feel doctors know better. And at the end of the day, they just nod to everything and then go, but still they have some reservations, but they didn't speak up because doctors know better. Then another one is, it doesn't really matter. Now, once I had to see a gynecologist, and I almost let one question slide because although it was very important to me, in the grand scheme of things, it wasn't really important. And patients can feel that way and not voice out their concerns because they feel, oh, this one will not kill me. But it could actually be related to what they came with, could actually help, but sometimes they just say it doesn't matter and they don't see anything. Another very important one is fear. Sometimes patients have questions on their minds, but they really don't want to know the answer to that question. Let me give you an example. So a patient comes to the hospital, a doctor gives you BP medications and say, take this for 2 weeks and come for a follow-up. And the patient has heard probably that once you start BP medications, you have to take it long term. But they have that at the back of their minds, but they don't clarify from the doctor. They just say 2 weeks, okay. So they take the drug for 2 weeks religiously, and after 2 weeks, they don't show up for follow-up. They stop taking the medications, and then 2 months later, they come back, and another doctor says, but why did you stop your medications? And they say, oh, but they didn't tell me that I was going to be taking it for long, right? So they had that question at the back of their minds, but they didn't ask because they really don't want the doctor to confirm what they already know to them. So fear can do that, right? And if we want to talk about it, the doctor actually should ideally tell the patient that, okay, this drug you are going to take is going to be long term. But even if the doctor does not say that, the onus is on the patient to say something. It's like two cars at an intersection. One has the right of way, the other is supposed to stop. But if the one that is supposed to stop does not stop, and you two do not stop, what happens? Collision. Yeah. And who is going to bear the brunt? Both of you, right? But on the patient side, they bear the brunt most of the time. So that's why patients have to be informed. We don't have to leave everything to the doctor. So the doctor should tell you, should give you so much information, more than you even need. But it doesn't happen like that all the time. But you too, if you are informed, even if they don't give you that information, you prod. Yeah, so those are just a few out of many reasons why patients don't voice their concerns in the consulting room, and then they leave the consulting room. Same question. Yes, that they came with.
Like they ask, "Oh, will I be taking these drugs for the rest of my life?" And they don't want the answer. Excuse me, they don't want the answer, or the answer you give them might not really reach them, or they don't fully. Wow, that's wonderful, Dr. Sani. So, from the doctor sides, why do you think some of these questions are met with like just numbness or hostility? Well, why do you think that is?
Well, so from the doctor's side, you have to, I think, like put yourself in each person's shoes, the patient side and then the doctor's side. There are so many reasons. For instance, let's start with the commonest reasons: burnout. You understand? So currently, well, even before this time, it's not like the doctor to patient ratio in Nigeria. It's quite acceptable. Is not. So there is burnout. You have a lot of patient load. You have a lot of patients to see, and then you spend so much time with a patient in front of you. You can hear others shouting outside. You understand? So if a patient asks some of these things, sometimes it may come a bit defensive, like, oh. Another thing is we forget as doctors sometimes. You've seen perhaps on a clinic day, I can see my 20 diabetic patients. They are different patients. They feel they should be the most special person in front of
Exactly.
you. Or you've seen 20 diabetic
Yeah.
patients and you've explained the same thing to them about, lifestyle, this, your follow-up and all. So maybe the first patient might be lucky.
Yeah.
But on the 20th patient, perhaps it may feel like, repetition and you feel like you've explained and, sometimes it's then it also comes to the fact that relational skills are not really taught in medical school. It's not something that is being taught as and then when you talk about who is a good doctor, you talk about people that have skills. Oh, you can do this, you can do that, you understand. But if you have the skills, that's very important to have skills, right? But if you can't communicate along with the patient, I think it's still deficient.
Yeah.
And a lot of patients are beginning to see that. So you see someone, sometimes you see a junior doctor saw a patient and be, no, that's the person I want to see. Maybe perhaps because the senior person didn't have that, skill to be able to communicate along. So that's why it shows that communication is actually very, almost as, if not as important as your skills set.
Yeah.
So I think those are some of the reasons why doctors may feel defenses. You're not used to that kind of, sometimes sitting down in that kind of discomfort with the patient. It's something that it needs to be learned. And so these are some of the factors.
So essentially, it's like both sides are hurting. Both sides have a lot of work to do in terms of meeting each other in the middle. And one thing I've found from all the things you've said is that people come from different backgrounds, different paradigms. So they see through different lenses. They expect, okay, the doctor yesterday, maybe he was just starting his shift. So the doctor was so kind and happy and spoke to you. And then you come next year and the doctor was just finishing a 24-hour shift. And you're like, okay, that doctor didn't hear me. He didn't listen to my concerns. It can't always be the same. Wow. That's okay. Anyways, let's keep going. So, Dr. Temitope, some people might listen to this and think, is this just another platform to blame doctors? Is that it? Tell us what it's about if that's not it.
Okay, so it's not a platform to blame doctors. We're not here to take sides. We're not blaming doctors or shaming patients or making patients out as difficult people. No, we're just here to talk about the issues, to highlight the issues. We want patients to find their voice whenever they have interaction with doctors. We want doctors to be able to explain better, and we are equipping them with those skills. And we also want stakeholders to realize the importance of communication in healthcare, that it's not only a soft skill, it's a safety skill when it comes to healthcare. And it's something that we need to invest in, bridging that communication gap. Both the public and the private sector, it's something we need to invest in. So we just want to highlight the issues. Because sometimes when you prefer solutions without highlighting the issues, people think they don't need that solution you are providing. For example, okay, from my experience, personal experience and the experience in my practice, I wrote a book, The Smart Patient. And I was thinking this is a book that, fills a gap, answers questions for patients, but they were not enthusiastic about it because they don't feel the need. I've not highlighted the problems to them, why they need it. So that was why it was met with that kind of, lackluster attitude, because I've not highlighted the problem. So that's what we're trying to do. We're highlighting the problem so that everybody knows that this is a problem and we should actually take steps to fix those problems. And beyond highlighting the problems, we're also preferring solutions. An example is that book, The Smart Patient. It guides anyone about how to interact with the healthcare system effectively. Then we're writing another one for new parents that guides them through the first 4 weeks of the neonate's life and how to interact with healthcare professionals even within that time. And then another one for doctors, talking about communication skills, like that framework I talked about in the beginning. So if every doctor, when you have to counsel a patient, you have to be scratching your head at, what do I tell this patient now? But what if you have a framework already? Like a patient is refusing admission or refusing care. These are the 3 things I do, pam, pam, pam. It reduces your brain work, as in the things you have to think about, right? Okay, so those are some of the things solutions we will be preferring. So we are highlighting the problems and we are preferring solutions. So we are not blaming anybody. So it's not a blaming platform, but we want everybody to come together, patients, doctors, other healthcare workers, policy makers, healthcare leaders. This is the forum for dialogue. We want to find solutions, but we need to talk. We need to highlight the issues before we can do that. So that is essentially what we're here for.
You said a few things that caught my attention. First of all, those books, are they available for the public to get?
Yes, they are available. We are rolling out the second book very soon. And then by February of this year, the third book will be out. Wow. Yeah, so they are available. They are very much available.
This is something we don't get taught in medical school. So, I mean, I would definitely like to have a copy or two.
Yes, you will. You will.
Thank you so much. So, Dr. Zulia, as a doctor now, why is this distinction that Dr. Temi talked about? Why is it something that we need to know?
Well, it's very, very important. It makes me feel safe because at the end of the day, what we're after is not just everybody wants a doctor that is well and a patient that is well. I think that's the output we're all looking for, right? And then that is satisfied, because not just well, right? We want them to be satisfied with the service we have given them beyond being well. You can be well and then, not be satisfied. So I think it feels safe that it's not just a blaming platform. We're just here to highlight the problem. And beyond just talking about these conversations, like she said, the PDF forum is still about, teaching some of these communication skills, learning and relearning some of the things we know about. So it's not just, we're just talking and not finding solutions. We're talking, we're doing research, I think that makes me very excited that it's not just about highlighting the problems, but highlighting the problem and going ahead to try and bridge the gap and look for a way to solve this problem. So I think that's
Yay for PDF!
And this is just episode 1, guys. This is 1. So let's talk about the podcast. Let's talk about where this podcast is going. What can our viewers and listeners expect going forward? What kind of conversations? What can we tackle right here on, from Patient Doctor Forum Nigeria?
Yeah, a lot. We can actually tackle a lot, and we are how to do just that. So we are going to be talking about fears on both sides, patient fears that they don't really communicate, but is there, right? Fears of the doctors, they don't want to be sued, right? That is also something that needs to be talked about, right? So we'll be bringing healthcare stakeholders, doctors, patients, caregivers, other healthcare workers, policymakers, healthcare leaders. So it's going to be an all-encompassing approach, trying to name the issues, right? And we're going to be offering practical tools also for patients, how to ask the right questions, for doctors, how to explain better, and just a lot of things. I can promise you that you are going to, yes. Yeah, so it's going to be a lot that we're going to be dishing out on this podcast. So,
whoa. And you guys, you're in for a good treat. And don't worry, the podcast will be accessible to anyone who wants it. But Dr. Zulia, tell me, please, you personally, what do you hope to explore in future episodes?
Well, real life experiences. We want to see real patient experiences. We have all been patients. We've been on both sides of it, and then from people outside.
I'm not sure of
that
that. I don't think he has ever been a patient.
What? It's not possible.
But we'll save my own for future episodes. But I have some good stories as well.
Being a patient relative, real life scenarios like, and highlighting where the problem was, how could it have been solved, what can we do to prevent it, and real life solutions that we can, prefer to some of these problems that we highlight. So I'm really excited, really. I can't wait for them.
Wow. So still with me here, Dr. Zulia. We're coming to a close now, but what would you say is one thing both patients and doctors tuned into our podcast can take away from this first episode?
Really, from my heart to you, what I can say you can take away from this is, on behalf of the doctors, we have good intentions. It's not like doctors are malicious or anything, but they go through a lot of things. The job is overwhelming, which some of you may not understand the context of that. So I think you should just give them some grace. And then to doctors, I think you need to also understand that care goes beyond good intentions, right? So you need to communicate better. These are some of the skills you need to learn. So I think if you can take these two things away, that doctors are not malicious and then patients are too, you also need to look at them like a whole human being. So I think these are things we need to take away from here.
Yeah, excellent, excellent.
Do you want to add anything to this?
So, just on a final note for me too. So, the thing is, healthcare does not break down in one day. It starts little by little. One unasked question today, one silence here, assumption there. She just talked about doctors not being malicious. It's some people assume that doctors are actually malicious. So one assumption here, one silence there, it actually leads to mistrust. It leads to even violence in some cases. You understand? We've had cases of violence in healthcare settings, especially in Nigeria. So all these things, they start, little by little. But the good thing is that as they start little by little, we can also build it back. We can also restore it one conversation at a time. One question answered, one explanation given, one negotiation, one very good negotiation with the patient that
Baby steps.
exactly. Now, I'm talking about that. I read a story online that is just so inspiring. So a woman went to a surgeon with a blemish on her breast, and the surgeon looked at the blemish and said, oh, this is really nothing. But he discovered a lump in another part of her breast and suggested or advised her to have surgery. But the woman happened to be somebody who believed in alternative therapies. So she said she was going to delay the surgery for like maybe 2 or 3 months while she tried alternative therapies. And the doctor said, okay. So as she was about to leave, she just turned and said, okay, but what was this blemish anyway? And the doctor, instead of saying it's a mitotic lesion that wouldn't have harmed you or anything like that, he just said, this was your angel giving you a wake-up call. And just because of that, she had surgery. This is not about clinical skill. He had already given his professional opinion, but that communication skill he displayed, it changed the whole game. So those are the kind of things that we are talking about, that is not often talked about. It's not only about expertise. It's also about relational skills, people skills. Because at the end of the day, it doesn't benefit us when, like that patient I was talking about, it doesn't benefit me in any way when the patient signs and then goes away. I want them to understand. I want them to do what is best for them. But like Dr. Sonny said, it goes beyond good intentions. You just have to have the skill. And that is why we are doing this. We want both the patient and the doctors to have the skill so that when they come together, they can have better conversations, and that can lead to better care.
Well, I don't know what to add to that other than saying I know that these conversations definitely build rapport, improve healthcare outcomes, and longitudinal care in general. And to our viewers out there, thank you so much for joining us on Care Conversation Podcast. If this conversation resonated so much with you, feel free to follow us on all our platforms and join us for our very next episode. It's coming really, really soon. And remember, better conversations lead to better healthcare. All right. Bye.
Bye.